Assalamu alaikum, dear students. In today's session, we will discuss about the Bloom's taxonomy. In this session, we will discuss about the domains of the Bloom taxonomy. That is called learning domains. We will also discuss about how to develop a learning objective, ranging from lower thinking to higher thinking order, and we will identify the strategies to respond to the level of cognitions. In order to start the session, about the Bloom taxonomy, first, it is necessary to give a brief background about the cognitive behavior perspective in the nursing practices, and later on we will discuss about the other objectives step by step. Bloom taxonomy is mainly focus on three domains that we will discuss about, like cognitive domain, psychomotor domain, and affective domain. In this session, the main objective is to cover the cognitive behavior and cognitive domain perspective in the nursing practice. As a clinical instructor or a clinical practitioner, you must understand that what is cognitive process, cognitive domain, metacognition, learning, and what is the difference between objective, goals, learning outcome, and outlines. In order to start the class, first of all, there is a need to discuss the brief background that how the cognition process occur and what is the mechanism that the learning occurs. Actually, the perspective of the cognitive behavior and perspective in the nursing practice is can be described by defining the psychology. Like psychology is basically the science of study. The science, psychology is basically the scientific study of behavior and mental processes. Like हर वो काम जो हम करते हैं, like eating, sleeping, drinking and sneezing, उस एक्शन से पहले हमारे माइंड में कुछ प्रोसेसेस होती है, कुछ थिंकिंग प्रोसेस होती है. That is overt, covert. Mean वो prior processes, mental processes is called cognition. And the action which we perform, that I give you the example of eating, sleeping, and drinking, that is overt. Like we can observe, someone other can observe our actions. So that is called behavior. So basically, in the psychology subject, we study the behavior and the mental processes. So the behavior are the action which uh, we can see, while the mental processes before the action starts, you understand the concepts before the action, that what I need to do, how to eat, when to eat, what to eat. So by starting this thinking process in the mind is called cognition. So basically, these mental processes and cognition is all also occurring and during in the learning process. So in the nursing profession, we take different decision at every minute, like having patient in the critical areas as a, being a professional, while working in the critical areas, ICUs, or even in the ward. The status of the patient is changing from minute to hours. So as a nurse, healthcare professional, or as a nurse, we continuously assessing and reassessing the patient condition, then understand the situation, the sign symptom of the patient, the objective science symptom and the subjective data, then we understand and take different decision to to plan intervention for that patient. And after planning intervention, at the end we evaluate the session. So all these process which go on step by step is called cognition, and we use that usually on daily basis. So the Bloom taxonomy is basically focusing on the cognitive process that as a clinical instructor or as a clinical practitioner, when you plan to deliver a content to the class, to the audience, or when you give some teaching to the patient attendance, you need to plan the content, you need to plan some objectives, plan some goals, and then you have to understand first, think first, and then deliver those content with the proper strategies and appropriate strategies to your audience, so that they can understand what you mean by. And the basic aim of presenting this content is so that your audience in the class reach to the same level of understanding. So similarly, for a clinical practitioner nurse, continuously we are taking a decision that required cognition, and we give teachings to the patient families. So all these process, these action require some mental processes, planning, thinking, that is what before these teaching plan take place. So these processes is called cognition. Now, as a clinical instructor, basically, to understand further, there are three level of cognition. And as a practical nurse practitioner, when you plan the therapeutic intervention for your patient, you also have to go through these three major processes, that is called automatic thoughts, the beliefs, and the core schema. For example, I will give you the example of a student in which the student come to his faculty member or to his teacher with an assignment or a teaching plan. And when the clinical practitioner, the teacher, the faculty member assess, check his assignment, his or her assignment, and reject her plan, her assignment, then automatically a thoughts develop in the student mind. That thoughts pop-ups in the student minds that the plan prepared by me is always worthless. बेसिकली इस एग्जांपल में ये एक्सप्लेन किया गया है कि जो हमारे कॉग्निशन और जो मीटा कॉग्निशन प्रोसेस है, ये हमारे लर्निंग में हेल्प करती है। जितनी ये हेल्प करती है, ऐसे ये हमारी लर्निंग को इफेक्ट भी करती है। जिस तरह मैंने इस एग्जांपल से क्लेरिफाई किया कि हमारे जो कॉग्निशन है या जो हमारे लेवल ऑफ कॉग्निशन है, वो 3 लेवल पे कंपोज्ड है। द फर्स्ट level of cognition is called automatic thoughts, the second is beliefs, and the third level of cognition is called core schema. तो जिस तरह मैंने इधर एक एग्जांपल दी कि एक नर्सिंग स्टूडेंट है, उसने अपनी टीचर को एक असाइनमेंट दिखाई, और टीचर ने जब असाइनमेंट चेक की तो उस असाइनमेंट को या टीचिंग प्लान को रिजेक्ट किया। तो स्टूडेंट के माइंड में पहला जो क्वेश्चन आएगा उसको हम ऑटोमेटिक थॉट्स कहते हैं। Like, she will feel that the plan, which the teaching plan or the assignment I have prepared, is always worthless. So she or he will generalize these idea automate and their automatic thoughts. So that is first level of cognition. And the second level of cognition, then she will believe belief that uh, about that the nursing that I cannot create a proper teaching plan. So her thoughts then converted into his or her beliefs that whenever I make a teaching plan or write any assignment, so that is not proper and is always rejected by the teacher. So I cannot create and I cannot make a proper teaching plan or cannot write uh, the correct assignment. So that automatic thoughts convert into the students' beliefs. And now in the third level of cognition, these beliefs then converted into the core schema. The core schema is almost a permanent change. Then she feel regress that the nursing students may feel herself that I am a useless. And this beliefs is influenced by her previous experience by rejecting her assignment by the faculty member. So this the level of the core schema is absolute core of beliefs that in which the student believes about themselves that if we consider in the above example like so the nursing student may judge that I am a useless and I cannot develop a fine and corrected assignment. So it clarifies that learning and mental cognition is directly interrelation with each other. Like as I have mentioned in the example of the student with the assignment to the faculty member, like see there are three level of cognition happen. So as these cognition level of cognition help them to develop a permanent mental schema by going through these three stages and their previous experiences. Similarly,